Welcome back to the Victory Education Lounge, everyone. I'm your host, Maurice, and today we're diving into part 21 of our series on insulin resistance. Before we begin, please take a moment to like this video, subscribe to our channel, and leave a comment sharing your thoughts or experiences below. Your engagement helps us reach more people with this crucial information. Today, we're exploring the economic impact of insulin resistance on healthcare systems. We'll delve into how this widespread metabolic condition is affecting healthcare costs, resource allocation, and overall economic productivity. We'll discuss the current situation, potential solutions, and prevention strategies, along with their pros and cons, and provide real-life examples to illustrate these points. Let's start by understanding that insulin resistance, often a precursor to type 2 diabetes, is not just a health issue, but also a significant economic challenge for healthcare systems worldwide. Insulin resistance, often a precursor to type 2 diabetes, is a widespread metabolic condition that contributes significantly to healthcare expenditures. The high costs are not just due to the initial diagnosis and treatment, but also the complications that arise from this condition. These complications can range from heart disease and stroke to kidney disease and nerve damage, each requiring its own set of treatments and interventions, further driving up costs. Let's take a look at the United States as an example. In 2017, the annual cost of diagnosed diabetes, a condition closely linked to insulin resistance, was an eye-watering $327 billion. Now that's a staggering figure. And what's even more concerning is that a significant portion of this cost is directly attributable to insulin resistance and its complications. This amount encompasses various costs such as hospital inpatient care, prescription medications, diabetes supplies, and even residential care. But that's not all. It also includes the cost of physician office visits and nursing facility stays, not to mention the cost of lost productivity due to increased sick days and reduced work capacity. What's more, these costs are not static. They are increasing year on year. The rise in costs reflects the growing prevalence of insulin resistance and its related conditions, coupled with the increasing cost of medical care. So you see, the direct medical costs of insulin resistance are not just substantial, they are alarmingly high and increasing rapidly. This financial burden is a significant challenge that healthcare systems worldwide are grappling with. And it's a problem that needs urgent attention and strategic solutions to prevent it from escalating further. As you can see, the direct medical costs of insulin resistance are alarmingly high and increasing rapidly. Beyond the hospital bills, insulin resistance also takes a significant toll on our economy. When we discuss economic impact, it's essential to consider not just the direct medical costs, but also the indirect costs. These include productivity losses due to illness-related work, absenteeism, and disability. Think about it. Every hour that an individual with insulin resistance spends away from work due to health issues is an hour of productivity lost. Every day that an individual is too unwell to work is a day's worth of wages that might not be earned. And these losses add up. According to the American Diabetes Association, the indirect costs of diabetes, which are largely due to insulin resistance, amount to approximately $90 billion annually. That's a staggering sum, considering it doesn't even include the direct medical expenses. The indirect costs of insulin resistance, while often overlooked, are a major economic burden. When it comes to the pharmaceutical industry and hospital admissions, insulin resistance is a costly affair. The skyrocketing prices of necessary medications and the frequency of hospital stays associated with insulin resistance-related conditions contribute significantly to the economic burden on healthcare systems. Focusing first on pharmaceutical expenses, we see that the cost of medications needed to manage insulin resistance and its complications is a major component of healthcare spending. To put it into perspective, consider this. In the United States alone, the cost of insulin was estimated at a staggering $15 billion in 2017. That's a threefold increase over a mere decade. This steep rise reflects not just the increasing prevalence of insulin resistance, but also the escalating prices of insulin and other related medications. Now let's turn our attention to hospital admissions. Conditions related to insulin resistance often lead to frequent and therefore costly hospitalizations. This isn't just about the immediate treatment costs, but also the resources tied up in managing these patients, from hospital beds to medical staff time. To illustrate, a study conducted in the United Kingdom found that diabetes-related hospital admissions cost the National Health Service approximately £3 billion annually. That's a significant slice of the healthcare budget, earmarked for a condition that's largely preventable. But it's not just about the numbers. Behind these figures are real people, struggling with a chronic condition and often burdened with the high cost of their care. They're facing not just the physical and emotional toll of insulin resistance, but also the financial strain it places on them and their families. So you see, the costs associated with medications and hospital stays are a significant part of why insulin resistance is such an economic challenge. The financial implications ripple out from individuals to healthcare systems and ultimately impact our economies. In our next segment, we'll delve into the long-term care costs and preventive care expenses related to insulin resistance. Stay tuned. Insulin resistance doesn't just hit us in the present, it's a long-term economic burden. It's like a ticking time bomb, silently escalating the costs of healthcare with each passing year. This financial burden is most evident when we consider the high costs of long-term care for complications and preventive care expenses. Let's first talk about long-term care costs. One of the most severe complications of insulin resistance is chronic kidney disease. This condition requires ongoing and costly treatment, often extending over a lifetime. Picture this: the lifetime cost of treating diabetes-related chronic kidney disease can exceed $200,000 per patient. That's a staggering amount, isn't it? This figure does not only encompass the direct medical costs, but also the indirect costs of lost productivity and reduced quality of life. Now let's move to preventive care expenses. Prevention, as they say, is better than cure, but it's not always cheaper, at least not up front. The National Diabetes Prevention Program in the US, for instance, costs about $500 per participant. However, this investment can yield significant savings in the long run. This program has been shown to save about $1,500 in medical costs per year for each participant. That's 3 times the initial investment, demonstrating the economic efficiency of preventive care. But these preventive programs also need resources, both human and financial, to be effective. They require trained healthcare professionals, educational materials, and often lifestyle modification tools. All of these factors add to the upfront cost of preventive care. But the potential savings in long-term care costs and improved health outcomes make it a worthwhile investment. The long-term costs and preventive care expenses underscore the need for effective strategies to address insulin resistance. It's a reminder that tackling this condition is not just about improving health outcomes, but also about making economically sound decisions. After all, a healthier population is a more productive one, and that's a win for everyone, isn't it? Insulin resistance doesn't just affect individuals or hospitals, it impacts our whole economy. The economic burden on individuals is particularly significant, with out-of-pocket expenses for managing insulin resistance often being quite substantial. For instance, a survey found that 1 in 4 people with diabetes in the US ration their insulin due to cost. This isn't just a health risk, it can lead to more expensive complications down the line, further straining healthcare resources. The ripple effects of insulin resistance also touch insurance systems. The high cost of managing this condition affects insurance premiums and coverage. In some cases, US health insurance plans have seen premium increases of up to 20% due to the rising costs of diabetes care. This not only impacts those directly affected by insulin resistance, but also everyone who pays into these insurance systems. But the reach of insulin resistance goes beyond national borders. It's a global economic issue, particularly in developing countries. The International Diabetes Federation estimates that diabetes, closely linked with insulin resistance, incurs substantial costs for economies worldwide. These costs come in many forms, from direct medical expenses to productivity losses, and can be particularly burdensome for developing countries where healthcare resources are already stretched thin. In a world where economies are increasingly interconnected, the impact of insulin resistance on one country's economy can have ripple effects on others. For instance, productivity losses due to illness can reduce a country's economic output, affecting trade balances and potentially leading to economic instability. We must also consider the human cost. The economic burdens of insulin resistance, from medical bills to lost wages, can cause significant stress and hardship for individuals and families, which in turn can exacerbate health problems and create a vicious cycle. As we can see, the economic impact of insulin resistance is broad, affecting everyone from individuals to global economies. In summary, insulin resistance is not just a health issue, it is a significant economic challenge. It ripples through our healthcare systems, causing substantial direct medical costs from treating the condition and its complications. Indirect costs, including productivity losses and disability, are also significant. Pharmaceutical expenses, particularly for insulin, and frequent hospital admissions contribute to the economic burden. Long-term care costs for managing complications and preventive care expenses add to this impact. Furthermore, the economic burden extends to individuals struggling with out-of-pocket expenses and insurance systems dealing with rising premiums. Lastly, insulin resistance has a global economic impact, affecting developing countries the most. By understanding the economic impact of insulin resistance, we can better strategize and prioritize our efforts to address this serious health and economic issue. Thank you for joining us for this exploration of the economic impact of insulin resistance. I hope this information helps you understand the far-reaching consequences of this condition and the importance of addressing it at both individual and societal levels. Remember to like this video, subscribe to our channel, and share your thoughts or experiences in the comments below. Stay tuned for our next video, where we'll discuss innovative global initiatives to combat insulin resistance. The information provided in this video is for educational and entertainment purposes only. It is not intended as medical or financial advice. Always consult with qualified healthcare professionals and financial advisors for personalized guidance.